Post-transplant instructions. It is of paramount importance that as patients leave, they leave with an understanding of how to treat these grafts. Free tissue grafts are their most vulnerable state in the first 48 hours before a process called imbibition occurs. That's a fancy word for saying vascular ingrowth, and that means that blood supplies, little blood vessels can attach themselves to the follicles so that they can continue to deliver the appropriate nutrients and antioxidant factors so that they can survive. During that time, we require patients to use a product that is prepared by a third party called a graft site kit. Graft site kit comes with a spray bottle. It has a blue substance inside the spray bottle. It also comes with a shampoo and a conditioner and some sponges or gauze impregnated sponges with also a solution that has a light blue tint to it. There is also a hydrating gel that comes in the kit, and all of these products are of paramount importance with respect to wound healing. By using copper, which is the common substance in all of these different delivery mechanisms, we've noticed that the resolution of erythema or redness has been potentiated from anywhere from 2 to 3 weeks down to about 5 days, which that just means that the recovery time is much, much faster. Spraying with the copper peptide about every hour. Some of our postoperative instructions say 20 to 40 minutes. Some say half an hour. Some say every hour to 2 hours. The idea is that you're keeping these grafts in a moist environment. You're not macerating the grafts, meaning you're not making them too wet, but there's certainly an ideal amount of hydration that's involved with the postoperative state of these grafts. You leave with a shower cap on that keeps these moist, and your head is wrapped. That wrap gets taken down on day 1, and you go into a shower. You take a plastic Dixie cup or a red Solo cup. In Texas, we have some country songs that are about the red Solo cup. You take one of those into the bathroom with you. You don't want to take anything glass, because if you break it, if you drop it, you break it, you cut your foot. So make sure it's plastic or styrofoam. And then you can fill that cup up with a warm water and pour that over the top of your head. You want to do that and take some of the shampoo and lightly shampoo some of the blood off of the top of your head in the first day. Blood is a great medium for bacteria to grow on, and we want to make sure that you're not having colony counts that get into the dangerous zones where we can see decreased graft survivability because of those colony counts can get over the 5,000 colony count per unit of area. Now, next you will rub a substance on the back of your head. That can either be a triple antibiotic ointment. We often will recommend bacitracin, but because of the normal population has about a 10% sensitivity to bacitracin, you can use any polymyxin B or neomycin or any of the antibiotic ointments. It's important to note that you need to put that on the donor site, okay? That goes in the back of your head. Not on the top where you've gotten the transplanted grafts, but just on the back of the head. And it looks like road rash at that point. But if you're able to do that and then wrap it for the first day after the surgery, I think that's the most hygienic way to sort of exist around the house. The second day is very similar to the first day after surgery, and that is wrapping your head, washing it, and putting that ointment on, along with showering with a cup and water, and putting about a dime size of shampoo and sort of using that in different areas on your transplanted grafts. By day 3, or at about 72 hours, you can start to take the pressure from the spout. At that point, it's okay to get your hair wet. Now, there's a lot of different ways that different plastic surgeons and hair surgeons will give you different instructions. In fact, some of them will say, don't let your hair get wet for a week. And I think that's not a great idea, and that just has to kind of center around the amount of skin flora and bacteria that can grow on those areas that can cause the grafts to die. And so that might be a reason why a certain practitioner that may be recommending those may have a subpar result, but that would need to be looked into. At usually about a week, certainly by 4 or 5 days, there's almost nothing you can do to hurt these grafts. Shy of UVA exposure. So for the first 6 months, I recommend a sunscreen. The sunscreens that you should use are an SPF 30 with a zinc oxide of better than 7 to 7.5% zinc oxide or more, and reapplying that every 2 hours. You want to wear a hat. Make sure it's a reflective hat, like a white hat or a neon yellow hat, not a dark hat that will still reabsorb UVA. UVA is about 10 times more potent than UVB. It's the type of UV exposure that you can get on a cloudy day. It penetrates through the window. In Texas, we have a lot of people with UVA damage on the driver's side of the car, and so we do some facial rejuvenation based on those types of exposures. After about a week, you are certainly taking biotin throughout this time. I recommend taking 5,000 micrograms. That's going to help the turnover of the cells at the level of the follicles in the donor area, so that your hair is going to grow back much faster. And I have no quantifiable evidence to prove this, but my feeling is that when you transplant a graft and it goes into a state of telogen or a shock phase, if you put someone on biotin, and we saw this over the last 2 years, we feel that the latency period, or that telogen phase, on 5,000 micrograms of daily biotin has been shortened. People tend to grow more hair more quickly, and that some of the grafts that would traditionally go into a shock state just continue to grow, as many as maybe 15 or 20%. That's the immediate postoperative instructions, and then by about month number 3 or 4, you can expect to see the initial signs of growth, and by about a year, your hair should be about 2.5 inches long. The more that we're doing this, the more that I see about 1 in 20 patients will continue to grow out to 15 and even 17 months. And so if you're looking at transplanted areas and you're seeing that you have some hairs that are particularly shorter than 2.5 inches and it's been a year, then rest assured that you're probably not at your final aesthetic result yet, and that you still have a lot more hair to grow.